Well, hello everybody, and welcome to our webinar. Sorry we're a little late in starting, we had a couple of technical issues. So I'm Emily Crossley, co-founder of Duchenne UK and mum to Eli with Duchenne, and I'm also joined by Alex Johnson, co-founder of Duchenne UK, mum to Jack and founder of Joining Jack. So thank you so much for joining us today for our webinar about lockdown and shielding. We're now 2 months into shielding, and so we wanted to focus on these two areas for discussion. And today's webinar is going to be a bit more freewheeling. We had great feedback from the webinar we gave with Nick Catlin and Janet Hoskin about homeschooling, and so we wanted to follow that more interactive approach. And I think today's webinar, Alex and I just wanted to say from the outset that unfortunately, it's not going to be about giving clear answers to questions. And I think that's because we find ourselves in such an unprecedented and fast moving situation that it really is difficult to find clarity on some issues. I think instead what we're hoping to provide here today is a safe and informative forum for discussion in which we can all offer advice, talk problems through and support each other that way. So the areas we will be focusing on today are unplanned hospital admissions, what happens if you have to go to hospital for something non-coronavirus related, telehealth, by which we mean your consultations with your neuromuscular team that might have to take place over the telephone rather than face-to-face, a discussion about shielding and schooling as we learn more about what schools might be doing, and siblings, how they're coping during these testing times. And then we want to finish off with sharing some positives about your experiences during lockdown. So to help us in today's discussion, we've got a fantastic panel, Dr. Chiara Marini-Bettolo, who's a consultant neurologist at Newcastle University. And we're also joined by some fantastic parents in the community, I'm sure many of you know, Joe Eames, Nick Catlin, Phillippa Farrant, Lisa Kuhwald, and Peter Duffy. So I'm going to hand over to Alex Johnson, who's going to start the discussion off. But just before I do that, if you do want to answer a question, just press the raise your hand icon and we'll try to cover as much as we can. So Alex, over to you.
Hi everybody. So we thought we'd start off today talking about unplanned hospital admissions. I think it's something at the moment that we all would dread. And just over 2 weeks ago, my good friend Lisa Kuhwald, who I think a lot of people who've dialed into this call know, phoned me on the way to hospital and said, Alex, I think Felix has broke his leg. And the panic, I think, and dread that filled us both was there. So I thought what we could start off with today is Lisa's kindly offered to share her story and some of the lessons that she's learned from the experience. So Lisa, I think you can unmute your line and tell us a little bit about what happened.
Oh, thank you, Alex, and hi everybody. Yeah, I think as Alex said a couple of weeks ago, we had a little bit of a stressful situation. I live near Manchester with my 4 boys who are aged between 16 and 9, and we've been shielding since mid-March, and for the majority of the time haven't been out of the gate except for a few short walks. Felix is 9, has Duchenne. He is on a trial at Alder, but I made the decision that it was too dangerous for him to go to the hospital. So, you know, just anxiety-wise and worrying what was going to happen. So that has been on hold for the last 2 weeks. So we, you know, just literally settled down with some schoolwork, lots of Xbox and playing in the garden. But 2 weeks ago, the decision was taken out of my hands when he just fell in the kitchen and twisted his ankle, and I just heard that scream when you know that something, you know, terrible has happened. And I think my first reaction was just complete panic. Oh my God, what can I do? I can't take him out. I can't leave the house. And then it was, will the car start? You know, is there any petrol in it? But I knew it needed checking. So in the back of my head, I'd always had a thought of where would I take him if he was ill with coronavirus or anything else. And I think the local A&E worried me just because we've not got, our team isn't there. So I did ring Alder, panicking, and asked them to meet me, and they took us through to a separate room in A&E. So I did take with me masks and gloves, his alert card, my phone, just so I could check as well, particularly the Duchenne emergency website, and snacks and drinks, because the thing I was thinking of is I just don't want to go to the hospital shop or anything like that. So, you know, anxiously we drove to the hospital, and I think each hospital has very different guidelines, and I think obviously they're changing all the time, so we just didn't know what we were going to encounter there. Once we got to A&E, Felix was tested for corona, but I wasn't, and the test takes 2 days to get a result. So none of the parents in the hospital are tested, even though they all stay with the children. So this did sort of surprise me, and again, it makes you nervous about who you're interacting with. I did also expect to see a sea of masks in the hospital, but the staff only wear them when they are with the patients. So when they're in the room with you, they have an apron, gloves, mask and a shield, and then they throw those away as they leave. But once a child was shown to be negative, the staff don't wear the shield anymore. So it's literally the mask and the gloves. But it was really calm and quiet at the hospital, which I suppose again surprised me, but it's just a lot quieter. And you could very easily get a car park space, which was a bonus. And they are still taking patients for emergencies and outpatients. So, you know, I think the big thing for me was to just keep telling them our situation and that we'd been shielding and, you know, we're absolutely terrified to be out, sort of thing. And as we've said, you know, his ankle was broken, so I have to visit the hospital quite a lot in the next few weeks. But it was horrendous, and you know, we were both scared. Felix was scared as well. He didn't want to go because he hadn't been out of the gate. But I'm not as anxious now as I was that first time, and it's mainly, I think, because I know what to expect. So I've just decided to wear masks as much as possible, and I think I'd just advise you to do what you feel comfortable with. You know, probably make sure you take with you masks, gloves, wipes, hand sanitizer, any medication, snacks, phone, pen, paper, so you don't have to borrow anything when you're there. And I think that helped my anxiety in a way, knowing that I had those things with me and I didn't have to borrow them from anybody. But you know, I really hope none of you have to visit A&E anytime soon, but you know, don't worry about it and just take everything with you. And I think, and I'd just, you know, explain your situation and you've been shielding, and hopefully everything will be okay. So thank you.
No, thank you, Lisa. I think Emily and I, we often, when we're speaking, we talk a lot about the resilience of Duchenne parents. And I just want to say, I think you are one of the most resilient and remarkable parents that I really do have the privilege of knowing. I was just wondering, what about follow-up now? Obviously, when a child with Duchenne or an adult with Duchenne breaks a bone, you'd expect lots of hospital appointments, physio. What kind of follow-ups happening with Felix?
Well, he is still having all that at the moment. So we're going every week. We went last week for an x-ray. We've got to go again for an x-ray. And then the plan is that we can go in for hydro and physio at the moment. Again, you know, obviously things are changing all the time, but I'm hoping that that will still happen. So, you know, we're still going in for the regular appointments at the moment.
Well, that's good to hear. I wanted to come to Chiara now. I mean, Chiara, do you have any sort of advice for parents if they face this kind of emergency about things we should think about doing?
Well, I think there are several points raised. These are very important. I think that you actually did the right thing. What I would have advised other parents to do, taking your alert cards and taking obviously your own thing to hospital. Say, even like the silly thing like carrying a pen with you means that you don't need to borrow a pen from someone else to sign a consent or to sign anything. Bringing in your own hand gel and snacks, making sure that you have everything that you need when you go. But clearly in a situation of emergency, planning for that, it's quite difficult. And with the anxiety as well of needing to go to a hospital, being exposed. So it's you did very well. I have to say, you know, you did well done, you. And other points that you raised were very important. And I think that generates a lot of anxiety is that each hospital, each trust is different, and there are different guidance, different policies. the uncertainty about people using PPE in the right way. And again, different guidance there between the various trusts, which has generated anxiety between professionals. So I can imagine as a parent, it must be really difficult. One of my concerns as a doctor towards my patient has been that being concerned that some care hasn't been provided because of the shielding, and some families haven't reached out, or a patient haven't reached out to healthcare professionals during this time, thinking that it was either not relevant or being afraid to enter the hospital. So I think it's still important that some essential care still needs to be provided, and we still need to access the hospital for these reasons. So as an advice, if you are concerned, even if you think it's something minor, do get in touch, and if needed, professional, particularly all of the neuromuscular community professionals will do their best to make sure that you are seen in a safe environment. At least that's what we've been trying to do here. And communication, so the alert card is very important, but also making sure that you contact your neuromuscular clinician and say, my child has been admitted, this and this happened, can you get in touch with the professionals in A&E? Because often, particularly during this time, people think all around COVID and not much about what is actually going on and the rare disease and the implication of a disease that most of the doctors will never see.
Thanks, Chiara. That sort of leads us very nicely onto our next slide for telehealth. I had my first experience with Jack 2 weeks ago, and sort of in preparation, it was due to be his normal 6-month checkup. So he would have had, his North Star assessment. He would have at this appointment had his heart scan, his DEXA scan. Obviously, those things didn't happen. But some of the things that I found helpful to do was I did elements of the North Star with him in advance of the call, and I videoed them. And I sent them through to his physiotherapist and consultant so that they could make some input, and we could discuss the things that were concerning me on the call. Like, for instance, his feet had started turning in. So as a result now of the consultation we have, they've put in place an app for him where he's doing different exercises. Do you have any tips of your experiences of telehealth, anything we can do as parents to prepare better for these calls?
So we've actually, our physios have worked quite hard in the last few weeks to put together some guidance to be shared nationally, particularly through the North Star network, to be able to do the assessment, as you said, do elements of the assessment remotely from home and report that to the physio. So we are rapidly implementing also video consultation. At the moment, we're only running the telephone consultation without the video facility, but there will be plans for particularly for children with boys with Duchenne to be able to do a North Star through video consultation. And I think that, as you said, there will be elements of it that will be easier, others less important, but it will be key, for example, if we have to increase the steroids or implement other things like exercise insoles and things like that. So it is rapidly evolving, and we obviously need the support, IT support, which is often not up to speed or crashing because so many people are using it. But I think that we are adapting, and families have done great in adapting as well to be able to do that, because it's not easy. The face-to-face is lacking, so it is different, but it is possible.
No, that's great. And we actually, we sort of our patient advisory board came together, and we've put together a guide for families with some, you know, tips on advantages and disadvantages of telehealth. So the link is on the slide for anybody who wants to take a look at that. So if we can move to the next slide now, we want to discuss shielding and schooling.
Sorry, Alex.
Yep.
Sorry, Alex, I was just going to add a couple of bits.
Yep, go on, Phillippa.
Interrupting. Hi everyone, it's Phillippa here. It's just because I'm working cross-country and across the whole community, reassuring with the telehealth, so that's fabulous what Alex has said. I think that'd be really helpful. And Chiara, just a couple of updates I've got today. So one was from the paediatric point of view that I received because I've been talking to the care advisor at Leeds, and they are actually looking with some, if there are some significant changes and they physically need to see you guys, they're looking at how they can set up a clinic where you can physically go in, where it would be safe, regarding PPE and making sure there was no one else around and all the rest of it. So some areas are looking into that so they can start running on the they're liaising with their cardiologists as well to see if there's some way of remotely doing cardiac checks, and they're also talking to other manufacturers, which you might have seen on the news yesterday, about ways of doing consultations, so using different equipment that they actually get to use on how. I'm not quite sure how to work. Again, using the clinic's got to be effective to work with the patient.
Okay, that's great. Thanks, Phillippa, for sharing that. So if we just have a chat about shielding and schooling now, I think it's probably important to point out at the outset with these questions that, you know, we don't know some of the answers to these questions. So the first question that was submitted was, now the government has started to relax lockdown, what does it mean for us when 12 weeks shielding is up? I mean, currently, as far as the guidance goes, nothing has changed. Extremely vulnerable people should still stay at home and practice shielding. And, you know, thinking about the next question, when does the 12-week shielding period end? I think the date we've all got is the 30th of June. And in terms of will shielding extend, you know, I don't think we know an answer to that. I know, Phillippa, you wanted to sort of make some comments about this following a Genetic Alliance call that you had.
Yeah, just really confirming what you've said, that shielding seems to be different dates for different people, but we're mainly going on the 30th of June. But also a Duchenne family down in Bristol has been told by their clinician that it'll be a further 12 weeks from the 30th of June. But as far as I understand from asking other clinicians around the country, and Chiara might be able to comment on this, nothing's been set in stone, and that must be just a one-off from Bristol Hospital. So I just wanted to see if anyone else really knew anything more, if they've been given different dates as yet. But we are looking across all the disease and trying to get a confirmation of the shielding as and when anyone knows anything for definite.
Chiara, I don't know if you've heard anything that you could share.
No, so what I'm aware is that, as you said, it's 30th of June. Some families have received a letter dated, received it a bit later, and then they got 12-week period starting as of now. But I think that the 12-week period is indicative and it may be extended. So we are waiting for government advice. I think it's quite tricky in terms of, that's what the government will advise, but some families probably, for some patients, we will advise to shield for longer. And again, even here, we haven't reached yet consensus, and we will need, we are discussing it, but mostly waiting for government advice as well. And in the meantime, trying to identify what obviously the challenges are for both, for patient, children, families, and it's not an easy task.
No,
it's the 30th of June as indicative date.
Yeah, and I think that leads nicely on to the next question. Are our children able to now go out on daily exercise with social distancing? I know in my experience, what I did is I actually rang Jack's doctor and had a conversation with the doctor, because I think they kind of, there's not going to be a one answer fits all for everyone living with Duchenne, because every young person and adult's health with Duchenne is very different. And in Jack's case, when I spoke to his consultant, he did feel that it was okay for me to take Jack out for walks in his wheelchair. You know, Jack's heart is okay, his respiratory function is good, he's still ambulant. You know, we are, when we go out for a walk, we are, practicing social distancing. So I think my personal advice to everybody would be to ask your doctor. I don't know if Chiara, you've got any thoughts on that?
I fully agree with you. I think now it needs to be an individualized decision based on a risk assessment, which it's not standard. So it needs to be, as you say, bring your doctor, and based on respiratory, cardiac involvement, make that decision. Sometimes mental health is important as well for child, parents, siblings. So going out is important as well, provided social distancing is respected.
Yeah, and then sort of the next question we've had is, if the family are shielding, is it best that siblings do not return to school in June or July? I think this is a really, really difficult question to answer again, because everybody's situation is very different. I know that one family who, the mum actually sits on our patient advisory board, she's had a letter from school saying that they've been advised by the local authority that people who are shielding siblings should not return to school. So that's the advice she was given. I don't know, Chiara, if you've got any thoughts on this from a doctor's perspective.
To be honest, I don't have an answer to this yet. I've raised it yesterday with the clinical team, and we will reach out also nationally to reach consensus on this. Again, there will be differences between schools as well. Some schools may facilitate the social distancing, but also depends on the risk for the affected sibling. So
yeah, I don't know.
It is very, again, individualized decision based on the school, how busy the school is, how possible it is to socially distance, and how affected the sibling is. So we will come up with some guidance in the next few weeks, but hopefully next week. But it will be difficult to reach consensus here again.
Yeah, I don't know, Nick, Catlin, or Joey, do you have any thoughts on this that you'd want to share?
Yeah, I've got sort of 3 or 4 points, I think. If I've got time to quickly make those, if I can.
Yeah, that'd be great.
Is that all right? Yeah. Hi, everybody. My name's Nick Catlin. I do some work with Duchenne UK. I'm a specialist advisory teacher. I'm also a member of the Teachers Union, the NEU, which has been putting out a lot of very interesting information around these issues. So a couple of things. First, as a personal opinion, I think June the 1st is way too soon to reopen schools to year 1, 6, 10 and 12. I mean, all of us teachers, and I know a lot of us parents, we all want schools to open, but we want them to reopen when schools are safe. The current, the kind of testing criteria, I personally think is first, are the COVID infections under control? There were nearly 2,500 cases yesterday, 545 deaths, which is something like 5 times higher than when the government started lockdown. So, you know, my first point really is, you know, I'm not convinced that things are under control to open schools. I think it would be much, much better if the government didn't set dates and said, look, we're going to, you know, open schools when we think things are safe. I think the second point I wanted to make is, and this is really important, both for Duchenne boys and their siblings, is we just don't know how COVID really is affecting children, you know, because there's conflicting evidence. And I think until that's resolved, that, you know, that uncertainty, in fact, the BMA came out this week and said, because of that basic uncertainty, whether children carry the virus, whether they can be badly affected by it and so on, we just don't have the evidence. And in that level of uncertainty, you know, I think that's another reason why we shouldn't be reopening schools at the minute. And the French schools, the evidence is not good. I've only seen a newspaper report that said 70 schools, when they reopened, had to shut down because of COVID cases. The second point I wanted to make is about testing and tracking, because I think that's one of the key things if we're sending our kids back into society, if you like, and into schools. You know, we want a really good system of testing and tracking in place so that we can follow up cases quickly. The third thing is, if your school has contacted you about reopening, either for your son with Duchenne or brothers and sisters, then there must be quite a rigorous risk assessment in place that's to do with social distancing, cleaning schools, availability of staff, planning teaching, and also for us, you know, plans for, you know, what are the plans for young people with Duchenne muscular dystrophy and other special educational needs, you know, coming back into school. My union, the NEU, has just produced an excellent checklist. I'll try and leave it after the webinar, the links, so that you can look at that and you can see, you know, the kind of criteria that the teachers, you know, want to have in place. So if your school is opening, the head teacher must have put a risk assessment in place. As a parent, you are entitled to see that, and so the teachers in the school and the local community. I would advise you, you know, to ask to see that and find out, you know, what plans exactly are going to be put in place. And also check with your school, is it going to be small groups? Is it going to be a period of time? You know, how are they managing, you know, the whole situation, whether it's primary or secondary? Because there is a risk. How big that risk is, it really is difficult to gauge. But what, you know, you have to measure that risk of sending your kids back into school against, you know, what difference is there going to be in terms of their education and social contacts, or even perhaps mental health. You've got to make these kind of you know, judgments with what's been put in place. The last thing I want to talk about very quickly is about education, health and care plans. And there's been a lot of stuff about whether education, health and care plans have been scrapped or whatever. Now, that is not true. Education, health and care plans are still in force, but they've changed the law temporarily so that schools and local authorities must undertake the provision, you know, what's provided for your son with Duchenne, with reasonable endeavours. And so I've been in contact with Alex Clark, actually, who's a parent. If he's on, I don't know whether he's on the webinar, but if he might want to talk about it. But that in where they live, they have, the school and the local authority have provided a kind of an action plan for their son, which is you know, laying down the provision that's in the education, health and care plan that they can reasonably provide. You know, things like specialist webinars for their son, precision teaching, personalised online classroom activities, and so on. And it's also stated things that they reasonably can't provide, obviously physiotherapy in school and one or two other things. So it is worth getting in contact with your special needs coordinator and having a look at your education, health and care plan, particularly the provision, and what is it in there that schools can still provide, especially things like, reading interventions or specialist maths interventions, or a bit of specialist teaching, or some support for you guys, all of us who are having to do a bit of sometimes a bit stressful homeschooling. I hope that helps.
No, Nick, that's really helpful, and I think you've made some excellent points there. I think actually, if you missed the webinar, the Decipher webinar with Nick and Jana, it's definitely worth listening to that, because I obviously took part in that webinar, and hearing Alex speak about the things that his school put in place made me contact Jack's school, because, I will hold my hands up. I've really, really been struggling trying to homeschool the boys, work full time. Jack is used to having his one-to-one sat at the side of him, helping him with everything. He has an anxiety. He can't answer a question without somebody checking it, but it's just the way that he's been taught. And when I did speak to his school, they have said that from next term, they are going to start offering him, as a start, a 1 hour Zoom lesson per day in his core subjects, which I think will be a massive help for us, and at least give me an hour where I can help my other son and attempt to get on with some work. So I really would encourage people to get in touch with the school if you are struggling, and ask questions. Don't be afraid to get in touch. I don't know, Joe, do you have any questions you want to raise or comments?
Hi, yeah. I just following on from Nick's really and the EHCP. So we actually had William's review literally about 2 weeks after lockdown begun. So I spoke to the school about it. We've luckily got a very, very productive school, and William's got a very good one-on-one. So as soon as they knew lockdown was happening, so they provided a very big pack of stuff for William, which even included loads of art stuff, all of William's equipment he uses for maths, pneumocons, the whole lot, his whole maths pack basically. So we've got all of those at home, and we actually get weekly packs from the school. I do for both my children. It's something the school are doing for all pupils, but William's is a much larger bag full of stuff, very targeted. I did contact the school probably about 3 weeks ago regarding having some more FaceTime with his teacher, because I felt that was something he was missing. So he has, and maths is something he finds extremely hard. So he's having FaceTime Zoom lessons with his teacher and his one-on-one teacher 2 to 3 times a week, which is really helping. Like others, it's giving me a little bit of time to give my daughter, who's 5, a bit more time as well with her learning. So that has been very good. We've also had phone calls from the county neuromuscular team to check that the school are providing for William. So that is another point of contact for people if they're not getting anywhere with their school. If their school aren't very proactive, then calling the people that are actually listed on your child's EHCP, the experts, may be another way to push some more support for you. So regarding EHCP and things, yeah, that's kind of, and schooling, that's where we're at. We're actually in the situation that my daughter Phoebe is in reception, so she is one of the children that could go back to school on the 1st of June. We won't be sending her back on the 1st of June because obviously we've got the 30th of June in our heads as shielding. I have spoken to the school about it. They have produced a very, very clear plan of action for children returning on the 1st. It's extremely thorough. Children go in for half the class go in for 2 days. The school gets thoroughly cleaned on a Wednesday, and then the other half go in for the other 2 days. but they have stressed that they won't be able to make 5-year-olds social distance. So, you know, they have been very honest in that. So every parent knows where they stand, and they will still provide the work that we require for Phoebe, because we are deciding to still school her at home, and we'll review it at the end of June. So that's kind of our situation at the moment in regards to kind of shielding and schooling.
Thanks, Jo. That's go on. Sorry, Nick, you go.
No. That's great, Jo. Thank you. And I just wanted to say, to back up what Jo said and what Alex commented before in the other webinar. You know, don't be afraid to contact your school, your class teachers, your Senkos, or even head teachers. You know, and ask for you know, provision of the sort that's been described to be in place. You know, don't be afraid to do that. But do bear in mind that it's amazing, you know, what teachers are, you know, the hard work and commitment that they're putting into to create these resources, because it's not, you know, they're doing it from scratch, really. Then this isn't the normal way that you know, that they work, and a lot of those teachers have got their own families. They're worried, you know, that they want to open the schools, they want to keep committing to our kids' education, but it's very, very stressful times for them as well. So, you know, so be bold, talk to them, but be nice to them as well if you can.
I agree. So the next question on the slides is, should carers be using PPE? I would think if you have outside carers coming into the house, you should be using PPE. I've been really lucky. I made the decision to let Jack's carer back in, and I've sort of made the decision in consultation with his social worker. And I don't know if people are aware of this, but you can contact the council's independent living team and they will provide you with PPE. So we're being sent a shipment of gloves, masks, aprons and hand sanitizer. So it's definitely worth looking into if you are having carers come into the house. I don't know, Chiara, do you want to make any comments on carers and whether they should be wearing PPE?
Yes, absolutely. PPE, they should be wearing PPE because carers will be caring for more than one person, and so that's where I see great risk. But with using PPE, I think that it's fine to allow them back into providing care for children or their patients.
Can I just make a comment? I think it's individual as well, because with the younger boys, that's probably a really good thing to do. But I know a lot of the parents with the older boys will be much more cautious. And there has been major issues with PPE, which is good to hear that you got it through that contact at the council. That's useful to pass out. But those that are on continuing healthcare and things have had issues because they've been told they have to buy it and they have to provide it, and they were struggling to source it. So it's slightly different, I think, in the older population.
Okay, and then the last question on the slide, how are you accessing supermarket shopping? Jack, we only got issued with our extremely vulnerable letter. I think it was 2 weeks ago now we got our first letter. So we couldn't get any of the supermarket slots, but what we actually did was contact the supermarket, and we shop at Morrison's, and they do have a community champion in store. And if you get in touch with the community champion, they will give you a telephone number so you can actually place your order over the phone and they will bring the shopping to you. So it's worth contacting. I don't know if this is in place with other supermarkets, but I know with Morrison's you can get hold of their community champion and they will do your shopping for you. If we move on to the next slide, I think we've actually covered these questions on the EHCP plans. So I think we can actually move to the siblings slide. Okay, so the first question we've got is, how can we support the mental health of siblings not really being able to leave their home? I know this is something that, you know, I am actually more worried about James's mental health than I am about Jack's. You know, James he's a very active child. He's used to going out and playing football, and he's really struggling staying at home, not going to school. And, you know, we aren't sending James back to school. So this is going to go on for a period of time. So I did want to bring in the lovely Peter Duffy, who runs the Duchenne Sibling Support Network, to see if he's got any advice or if there's any siblings who've been sharing their stories on lockdown.
Hello, Alex. Hi, everyone. Am I unmuted?
You are unmuted.
Awesome. Sorry, I never know. Okay, yeah, so I think it's really tough to have kind of come to a kind of consensus on this and sort of give, you know, specifics in terms of advice. So when I was thinking through this, I was thinking about kind of the different situations that siblings can find themselves in. So yeah, I had a little chat with the group last night, and some of them put some of their ideas forward. So I was going to say that I think it's worth noting that I think there are different groups and different types of situations that siblings are in at the moment. So you've got, on the one hand, the sort of child siblings living at home with the family. They might be younger or perhaps coming to their teenage years, and they'll have sort of different sets of issues to potentially a second group, which is older siblings living in the family home at this point in time. And then perhaps a third group, older siblings living in close proximity to the family home and or acting in a carer role. So those bring up a whole new level of, well, do they interact, you know, how do they, you know, come around and partake in normal family life, so to speak. And then a fourth group, which I think kind of probably can get forgotten as well, which is older siblings that are living away at distance from the family home. So yeah, I mean, I spoke to people who fit into kind of all four different categories. And yeah, I mean, I know even some who are in that final category of living at quite a distance from the family home, but they're saying that their mental health's been kind of considerably compromised by not being able to be there and kind of you know, see how things are and care for their sibling. So in terms of what the siblings, kind of what siblings are going through, I think it's important to kind of recognize and just try to understand what siblings are going through at this point in time. So yeah, I think some of it is the larger sense of what it is to be a Duchenne sibling in general. And a lot of this actually brought me back to one time when a Duchenne sibling said to me, she said that when she was thinking about growing up as a child, she said that every time someone was looking at her brother kind of a bit funny, or as if he was different or other, she felt that they were actually looking at her too. And whatever that feeling of difference was felt by her brother, that was actually felt by her. And I think it's important to recognize because it's often forgotten. I think as a Duchenne sibling, you're expected to conform to the sometimes difficult norms and standards and requirements of your sibling, the person with Duchenne. Although you may not often be given credit for doing so. So there's the added issue that's particularly pertinent in times like these when everyone's on lockdown, that the person with Duchenne there's this added thing that the person with Duchenne and their family, parents, kind of don't have in this scenario, which is choice. And I think that that's something that's really sort of extra pertinent in this situation. So for someone living with Duchenne, it's, you know, this lockdown is what they have to do. For the parents, it's what they have to do. But for the sibling, kind of obviously it varies depending on the ages. For the sibling, this is, you know, this is a choice, and they have the ability in some circumstances not to conform. So there's this sort of added thing that's being taken away, or added restraint that's being put on. So I think obviously there's nothing, you know, there's no kind of quick fix, or, you know, there's no solution to any of this. But I think the key thing is just kind of being aware of it, because I think that with Duchenne siblings that can often get forgotten, if you see what I mean. So yeah, I just I'm sorry, I'm just going through some of the notes that I'd written on this. So yeah, those choices. So those choices of leaving a family home, of going out, not going out, those choices are at their disposal in a way that they aren't for the person living with the condition. Not that it makes it better or worse, but it certainly needs to be acknowledged when factoring in for support. I'd also note the psychology of the community kind of being paused, so to speak, during this pandemic. So I think that, you know, I've obviously, I was growing up in times before the internet and times before, you know, when there was fundraising events every week and such a engaged, active community. But I've often thought about how that really does help siblings to kind of get involved and sort of do their bit, or certainly feel like there's, you know, a goal being worked towards. And I think that obviously it helps parents in so many ways. It helps the family in so many ways. And I think it's important to recognize and realize how much it helps siblings as well. So yeah, I think on some level there are two elements that I think the community is being affected, or that kind of community vibe is being affected by this kind of pause that this pandemic is putting on. One is the trajectory of kind of the idea of, well, you know, working towards this cure or a really strong treatment. And the other is that kind of pause of all the events that are being cancelled that kind of really help for kind of emotional support, or that kind of feeling of engagement, of involvement. So I'd just be aware of those two factors, and just, you know, obviously depending on the age of the sibling, you know, if they're young and perhaps susceptible to being aware of what the parents are going through, what the parents are feeling, just kind of being, you know, just being aware of that and being vigilant that their emotions might be affected by all of this in a way that is similar to the parents as well.
I think that's really good advice, Pete, that you're giving.
Thanks. Yeah, that was more or less everything that was raised in the group, and the things that I was thinking through. Yeah, the final thing that I'd note is that we have the sibling support group on Facebook. It's Duchenne Sibling Support Network. And yeah, we have the page which everyone can like and share things through there. Obviously, it's only, you know, recently started, so it's still growing, and we'll put more things up in time. And then we have the internal group, which is just siblings. We have about 30-40 people at the moment, mainly from the UK and the US. And yeah, that's just for people to be able to come together and ask each other questions and share experiences and give advice. And that's people 16 and over. But we are also looking to do family days out as well, to involve younger siblings. I'd kind of planned to do a couple of those for this year. Obviously, that's been a little compromised by the current situation. So just looking to offer support in every way that we can through the group at the moment.
That's great. Thanks, Pete. Can we move to the final slide now on positive experiences? I think, you know, COVID literally has, in some cases, turned our world upside down. But I think one thing that I really feel is it has created, you know, a really strong sense of community support. And I think one thing at Duchenne UK we want to do is offer people hope. You know, I think during this period, I've personally been touched by all the people that have offered, you know, a helping hand. You know, people realise the impact that it's had financially on the charity. You know, I loved seeing the 2.6 challenge and all the families that have got involved, and, You know, we've got the virtual Duchenne Dash coming up, and we've had lots of families coming together actually as teams to try and make up the miles that they've set for their challenges. But also, you know, for me, some of the positive experiences have been that trying to change my own mindset. I've tried to make time each day where I do some exercise on my own, or I've been trying to do some yoga just to help myself mentally. And I think, you know, I'm a big believer in that kindness can turn things around for people. So I don't know if anybody wants to actually share positive experiences of lockdown. I know, Phillippa, you wanted to say a few words.
So yeah, just going on from that, I totally agree. And actually, listening to this webinar today, I've been really struck by the positiveness in what we're all going through and what we're all having to put up with and change our way of thinking, right through from the clinicians, right through to the our charities, and changing our sort of trajectory as well. Like for DFSG, for instance, we can't do our support that we wanted to do, and Peter, Duffy and I were going to do some sibling events, so we're a bit frustrated on that, but it's rethinking and that. And for me, the working together of all the Duchenne charities I felt has been really solid, because obviously, as you know, I do a lot across charity, and I also work with Genetic Alliance, and I've really felt the whole community across all rare diseases, but particularly us in the Duchenne world, really come together and bonded during this time, which is really great. We're all on the same side and supporting each other. So thank you to everyone there and those that messages through. As Alex says, your messenger message side. I know it's really wants to know that people we are unique, I reckon, as parents and a community.
That's lovely. I don't know, does anybody want to raise their hand, and has anybody got any questions for the panelists before we finish off?
Alex, it's Chiara. I just wanted to add something. Just first, also a positive experience is patients' positivity. When we have been calling the telephone consultation, there's been a lot of positivity and a lot of energy, which has been great to see how all of the families have been coping extremely well, and just putting up with a lot of challenges, homeschooling and concerns, but also that they, families who've taken the time also to write a little note and a card. I think that has made our days as well. So that's been really nice, that you found time to reach out to us. At the same time, I'd just like people, if in doubt, if there is any concern, to reach out to your consultants and clinical team. If you have any concerns, we are here and here to support you.
Oh, thank you, Chiara. I think we are, as a community, truly blessed to have lovely clinicians like you.
Thank you.
Emily, is there anything you want to say in wrapping up? I don't think. I think we can just move to the final slide.
Oh, hi, Alex. Sorry, it's Emily. Can you hear me?
Yeah, I can hear you.
So sorry, my computer died and that kicked me out of the Zoom meeting. I just wanted to just jump in quickly before we end about positive experiences, because firstly to say thanks so much to all our panelists today for a really excellent discussion. And I just wanted to pick up what you mentioned, Alex. It's so weird how we basically seem to think the same things without even talking to each other about it. But in terms of the positive experiences, what an amazing community this is. And I think when we ask people for help with the fundraising challenge in place of the marathon, I think we raised more than £30,000 on that, which is really remarkable given how much stress everyone is under, and the way people are coming together in these webinars and really supporting Duchenne UK. And I think that the charity is in quite a remarkable position. And it's really down to you guys, everyone who supports us and tirelessly raises money for us, because we will not stop funding research during coronavirus. You know, Duchenne isn't standing still, and we are not going to stand still. You know, we have enough money to honour all of our obligations, so no research projects will stop on account of us. We are announcing new, exciting and important projects in the coming months, thanks again to your support. There was some positive news last week on gene therapy, so do please check our website for the up-to-date announcements from the companies in this space. And we are working with the DMD Hub to bring those gene therapy trials to the UK. So I just wanted to say a massive thank you to our supporters, because without you, we wouldn't be able to be in this situation. And please, you know, rest assured that we are working just as hard to fight for treatments, and we won't stop even with coronavirus.
That's true. I think we're more determined than ever. So I think if we just move to the last slide now. There we go. So here's a list of our useful resources that we think are helpful to have during this time. And then the next slide. So yeah, if anyone has any questions that have arisen today, or you think of anything that would be helpful for us to share with the community, please get in touch with us. We're always here. You can email us at support@duchenneuk.org. So yeah, we're here, and thank you very much to everybody for listening.